When you're healthy, you oftentimes want everything in the world. But when you're sick, you only want one thing: your health. Today, we're going to be taking a look at one of the bigger problems in the United States that is crippling millions upon millions of American families and making it so that they're unable to have the freedom to oftentimes make the choices that they need to live a happy life. Today, we're talking about medical debt. Imagine being blind, imagine being deaf, and having no idea that your bill got sent to collections. Imagine seeing your insurance premiums going up and having no idea why. This is exactly what happened to a Missouri man, reported by NPR, who saw an 11% rise in his home insurance premiums because medical debt that he was not aware existed was sent to collections. We see more stories over here. Another insurer kept sending a visually impaired Indiana woman bills she said she could not read even after her complaint to the Health and Human Services office. This is a problem across the US, and not only for people who are deaf, not only for people who are blind. This is a situation where millions upon millions, by some reports up to 100 million Americans, are trapped in a cycle of medical debt for commonplace treatments that they simply need to survive. Now, we can have conversations about the broader issues in the healthcare system. However, we are not going to be talking about that today. Today, we're going to be looking at the rise in medical debt, the people who are most affected by it, the realities that create it so that some people are unable to leave the cycle of medical debt, and a solution that you and I can do right now to help people get out of it. One of the things that most people don't know is that chronic disease has been rising over the past 50 plus years. Over here, we can see with this study from the National Library of Medicine and National Library of Biotechnology Information, NCBI, chronic diseases are among the most prevalent and costly health conditions in the United States. Nearly half of all Americans suffer from at least one chronic disease, and the number is growing. Chronic diseases include cancer, diabetes, hypertension, stroke, heart disease, respiratory diseases, arthritis, obesity, and oral diseases. They lead to hospitalization, they lead to long term disability, reduced quality of life, and death. In fact, persistent conditions such as chronic disease are the nation's leading cause of death and disability. In terms of public insurance, treatment of chronic diseases comprises an even larger portion of spending. 96 cents of every dollar for Medicare and 83 cents of every dollar for Medicaid is towards chronic treatment. Nearly 75% of aggregate healthcare spending, or an estimated $5,300 per person annually, according to the CDC in the US alone, is for chronic disease. Now, we can discuss the problems of the healthcare industry, and we can discuss how the fact that nobody, unless they are at a certain level of affluence, gets preventative care, about how the system is overcomplicated, overburdened, and people don't even want to engage with the system due to the cost barriers. But again, that's not our conversation today. Over here, we see a recent Milken Institute analysis determined that treatment of the 7 most common chronic diseases, coupled with productivity losses, will cost the US economy more than $1 trillion annually. This is due to people who are unable to work from disability. These are people who are constantly being in and out of work because they have medical conditions that are being treated. This is because of the fact that people are not able to participate in the economy because their debt is crippling them, and they're not able to actually have discretionary spending. They don't have any money that goes into anything other than crippling debt. Over here, we can see from a website, fightchronicdisease.org, the growing crisis of chronic disease in the United States. Over here, we see again the number: 133 million Americans, 45% of the population, have at least one chronic disease. Chronic diseases are responsible for 7 out of every 10 deaths in the US. And the thing is that when somebody has chronic disease, they are going to need continual treatment for the rest of their life, which means that in a economy and in a healthcare economy that is driven by debt, that creates debt whenever somebody seeks treatment, because oftentimes insurance will deny treatment. What ends up happening is that these people, 45% of the US population who have a chronic disease, are in a perpetual cycle of increasing medical debt until they either stop seeking treatment or die. That's the reality of it. We can see right here, people with chronic conditions are the most frequent users of healthcare in the US. They account for 81% of hospital admissions, 91% of all prescriptions filled, and 76% of all physician visits. Again, we can discuss the preventative care that is ensuring that these people are not getting treatment earlier before their conditions become chronic disease. But we're looking at the debt specifically here. Over here, chronic disease costing US employers and employees. Healthcare premiums for employee sponsored family coverage have increased by 87% since 2000. That is not exclusively due to chronic disease. There is many failures in the medical system and in the healthcare system. We can see over here, healthcare coverage costs for people with a chronic condition average $6,000 annually, $6,032 annually, 5 times higher than for those without such a condition. By 2025, chronic diseases will affect an estimated 164 million, nearly half, 49% of the population. The number of people with chronic conditions is rapidly increasing. Over here, American Public Health Association, Americans are living longer, but chronic diseases like diabetes, heart disease, and cancer are taking a growing toll on our health. And remember, every chronic disease for the vast majority of people means that they are creating medical debt that they are stuck with for the rest of their life. Over here, with more chronic disease comes more medical debt. A new study shows that the dollar amount of medical debt increases with the number of chronic diseases a patient has, which is leading to adverse financial outcomes. They have less spending power. They participate less in the economy. They are able to participate in the labor economy less. These are all things that are bad for the economy. There is no actual value being created by medical debt other than the value for the shareholders of the companies that carry that debt and collect on that debt. As we can see over here, another article from NPR. Sick and struggling to pay, 100 million people in the US live with medical debt, from June 16th, 2022. Another article from Slate covering the same topic. Over here, another article from the RAND Corporation, Chronic Conditions in America, Price and Prevalence. Over here, this same study, a new RAND study finds that 60% of American adults now live with at least one chronic condition. 42% have more than one. They account for hundreds of billions of dollars in healthcare spending every year. And that does not even account for the loss of economic activity. This is only the healthcare spending that goes into treating and maintaining care for these people, for these individuals. So if we have 100 million people plus in the United States who are living with medical debt, the solution should be, well, let's get together and solve this. Let's solve this through the private markets. Let's solve this through public policy. But unfortunately, this is a topic that has become politicized. You have people who do not want any action on this because they're bought and paid for by lobbyists. You have good faith people who have differences in opinion in how the healthcare industry should be fixed. And so they get so caught up in the arguments of fixing healthcare. Oh, is healthcare a public thing? Is it a private thing? Is it the state should be more competitive? There should be increased access by the insurance providers. Should insurance exist? Should insurance not exist? That we kind of forget that the point is helping people. And it's really challenging because when you're looking at this as an individual, it becomes very hard for us to feel like there's anything that we can actually do to help. It's not like I, as an individual, can on my own change the way that private insurance covers healthcare. It's not like I, as an individual, maybe if there was a concerted, organized effort, and we have seen that happen and oftentimes fail repeatedly, both through the private markets and through public policy. But it's not like I, as an individual, can sit here and say, oh, wow, I want that legislation to pass. Well, we've tried that in many different forms. And my hope is that we can build this conversation to a point where we're able to get that policy platform passed in a way where every single citizen is protected, where medical debt doesn't exist anymore. But unfortunately, that is not where we are right now. And with that in mind, I want to take the opportunity to introduce you to an organization where you and I can address this issue right now. There's an incredible organization called RIP Medical Debt. And what they basically do is they have relationships established with some of the collections agencies. Now, if you don't understand how collections agencies think, the best way to understand it is that they understand that they're never going to get every dollar back. So oftentimes they're willing to sell debt for whatever somebody is willing to pay for it. They will sell debt for way cheaper than the amount that is due because that way they at least get some money back on it. They recover some funds from it. And so, what RIP Medical Debt has done is they have brokered relationships with a lot of these collections agencies where they are able to buy debt for pennies on the dollar. And then they turn around and they forgive it for people 100%, no questions asked. There's no need for somebody to apply for their programs. They just buy a massive tranche of debt, of medical debt, and then they forgive it. What this does is this creates life changing freedom, financial freedom for individuals who have spent oftentimes years, decades trapped behind medical bills. They have relieved over $7 billion in debt so far for over 4 million families. As we've discussed, over 100 million Americans, 1 in 3, struggle with the weight of medical debt. RIP Medical Debt is able to buy that medical debt at a steep discount. They buy debt in bundles, in tranches, millions of dollars at a time at a fraction of the original cost. The collections agencies are able to get some money back, and then they are able to forgive significantly larger amounts of debt than the actual monetary value that they're buying. This, as they say right here, this means your donation relieves about 100 times its value in medical debt. And so this is an organization that I've happily donated to in the past. I highly encourage that you donate to them as well. It's ripmedicaldebt.org. You know, at the end of the day, we may not have the ability in our country right now to solve this through legislative means or to solve it through private market solutions. If I was to share my own opinion, would be some kind of public private option where everybody has coverage, but then there are private facilities for people if they wanted to pay more. I think that's a perfectly fine solution as long as the baseline is that everybody gets coverage and it's well funded. However, in the meantime, we can donate $5, $10, $15, $50, $100, whatever is right for your budget, to an organization like RIP Medical Debt, where they're able to buy millions, billions upon dollars worth of debt and forgive it for families who one day get a letter in the mail saying your debt is forgiven. If you're able to, I highly encourage you to donate. There'll be a link at the bottom. I appreciate you taking the time to watch this video. I hope that you have an absolutely wonderful rest of your day. And if you feel like you've learned something in this video that you can share with people, feel free to subscribe so that in the future you can see when I do more videos like this. I hope you're having a wonderful day, and I'll talk to you later.